These sites that are providing medicines illegally without doctor's prescription, without medical supervision, some of these medicines can cause brain tumours, can cause kidney issues, can contribute to blood clots. These things worry me. They worry me that these access to medicines that you don't know what they are or where they're from. Is there any realistic way to access NHS gender care? I wish there was, but I think this crisis is going to get worse. One could argue that the NHS themselves should be paying for your private care, and it's because now, when I started this work 10 years ago, I'd never heard of the concept that patients would go online to the black market, the grey market, whatever you want to call it, and buy medicines because they couldn't get them available in public services. I'd never heard of it. And yet here in gender care, it's rife. You have websites telling people what to do and where to go and how to buy medication without a doctor's prescription. And the trouble is, yes, needs must, and you have to do that. But is it safe? There is a reason why these medicines are prescription-only medicines, and it's because it's important to get the dose right, it's important to get the drug right, and it's important to get the levels of hormones right. Some of these medicines that have been used can cause brain tumours, can cause liver problems, can cause kidney issues, can contribute to blood clots. So it's important that we get this right. And that's why medically governed care is essential. So I've been looking at DIY a lot, and I've been looking at some of the questions that people have been asking about DIY, and I'm here to answer them honestly for you. Where can I get HRT now that OpenGate and OGL has shut down? I mean, these things worry me. They worry me that these access to medicines that you don't know what they are or where they're from. They worry me. So please get yourself under some kind of clinical supervision so that a doctor can prescribe and monitor your medicine and your gender-affirming hormones. Why are so many HRT sites out of stock right now? I mean, there sure is a lot of people transitioning, which is fantastic. I'm so pleased that people are becoming themselves and are able to medically transition. But on the same side, these sites that are providing medicines illegally without doctor's prescription, without medical supervision, they will get shut down. They can be very expensive, and you don't necessarily know what you're getting. And because many of them, I'm not saying any particular ones are, but because many of them are illegal, it does mean that supply will be sketchy and the sites themselves will get closed down. Is it safe to use an old vial that has already been opened? You see, it's difficult, isn't it? Because again, in the olden days, there would be a nurse or a doctor supervising your injections, a pharmacist making sure that your injections were stored properly, used properly, kept properly. What kind of vial are you using? Is it a glass vial? Is it a rubber-topped vial? Which needle size are you using? Is your supply of needles safe? Is that particular medicine okay to be reused, or is it one that needs to be kept in the fridge? Is it single use only? These are really important questions, and they're not necessarily very obvious if you buy a package on the internet and have it delivered at home. So it does depend, and that's where pharmacists and healthcare professionals will give you the right advice. In the meantime, have a look at the packet, have a look at the label, have a look at the instruction leaflet. What is it telling you in there? Is it a legitimate source? Can you trust the source where this medicine's come from? Is it giving you the right advice? Anything that you get from a doctor or a pharmacist, a licensed pharmacist, you can trust. Other things, just be a little bit careful. How do I get blood tests done without a doctor willing to help? There's lots of places you can get blood tests done. You can go online, you can buy a blood test package, make sure it's attached to a proper licensed laboratory so that you're going to get the results that are true and honest and accurate. And also make sure that that service has a doctor attached to it to analyze the results. Different laboratories have different reference ranges. They will have different numbers that are normal. They'll have different calibration machines in different laboratories. So it's important that somebody out there is assessing your blood tests for you or with you and showing you how to do it. So yes, there are other ways that you can get your blood tests. Do it through a reputable source. Make sure you know you're doing, and make sure that somebody else is analysing them for you against your doses to make sure that it's correct. It's really important. Sorry to interrupt. Thank you so much for being here. Thank you for listening. Thank you for watching this video. I notice that some of you don't actually subscribe, and it would really help me if you did subscribe, and it will also make sure that you can get my next video if you want to. So just click the button. So what happens if you're forced to stop HRT because of the supply crisis? So everything's going smoothly, you're on HRT, you're happy, it's all going well, and then all of a sudden you can't get your medicines anymore. So if you're attached to a proper service, your doctor will help you make sure that your supply is not interrupted. Your pharmacist will have different supply chains. The doctor can use different pharmacists to send your prescription to. And that's why it's so important to make sure that your care is being properly looked after. You should never be in a situation where all of a sudden you can't order your medicines anymore, and your supply is stopped, because you need your hormones, especially if you've had operations, which means you're not producing your own hormones anymore. Hormones are really important to get right, and you don't want fluctuations and sudden stoppages. So make sure that your care is being properly looked after and your supply is secure. How can you tell if an online HRT is legitimate or not? What you'll definitely need to know is that a doctor who is registered with a medical body, whether that's in the UK or abroad, make sure your doctor is licensed to prescribe that medicine for you, and also make sure that the pharmacist that you're getting your supply from is licensed to supply that medication against your doctor's prescription. And that's how you absolutely know that you're getting proper medication. If you're buying it without a prescription, that's big alarm bells. If you're buying it from a site that isn't registered as a proper, honest online pharmacy, have a look at the bottom bar. Is there a registration there? Is it a real, proper, registered pharmacy? And if not, I'd be very worried. Is there any realistic way to access NHS gender care in the UK right now? I wish there was, but I think this crisis is going to get worse. The gender specialists in the older clinics will be retiring. Have they made provision for new specialists? Have they done training? Have they got new doctors in place? I don't know. I haven't seen, but I certainly haven't seen those waiting lists come down. If we have a look at some of the waiting times on the NHS, the Sandyford Clinic in Scotland, projected wait 224 years. Brackenburn, 41 years. The Laurels, 31 years. So what are we going to do in the meantime? Well, we have to just go privately. And actually, there's a big question to be asked there, because for other examples in medicine, for example, if you're waiting for a hip operation and the NHS can't provide it for you quick enough, then the NHS should pay for you to go privately. And that situation is what's happening in the UK with gender care at the moment. The NHS can't provide it quick enough, and it can't, or at all. So one could argue that the NHS themselves should be paying for your private care. I mean, maybe we're a little way off that argument, but it's an argument that we need to be having. So I know lots of people feel very desperate and they want to do DIY and they want to make sure that they can medically transition. But there are other solutions, and private healthcare doesn't have to break the bank. It can be affordable. And, the online places where you buy your medicines from, you have to buy them anyway. With providers like Gender GP, you still have to buy your medicines from the pharmacy, but at least you know you're getting proper medication that's being supervised. Thank you for listening. And right now I'm building this out on my website. Come and have a look, helenwebberley.com. Get in touch with Sammy, who sits there waiting for your questions. If you've got anything that you want Sammy to ask me, just pop on my website, ask Sammy. It comes straight to me. Please be careful with your DIY healthcare. Please get yourself under clinical supervision, and please start demanding that the NHS provide you with proper care. Look after yourselves. Love you.